Good evening and welcome to Woman. Women have only begun to explore their sexuality, scientifically and in talks among themselves. The truth is coming out. Tonight on Woman, Part 2 of Female Sexuality. This week we will discuss some aspects of female sexuality with two women who have listened to women themselves and have learned about their sexuality. My guests are Shere Hite, a researcher who has compiled illuminating responses to an extensive questionnaire for women concerning their sexuality, and Dr. Helen Kaplan, a psychiatrist, psychoanalyst, and director of the sex therapy clinic at New York Hospital, and one of the few women to hold both MD and PhD degrees. Welcome to both of you. I forgot to mention your book. Shere, your book is Sexual Honesty by Women and for Women, and Dr. Kaplan, your book is The New Sex Therapy. I found both of them absolutely fascinating. Shere, your book is made up of this questionnaire. I'd like to know a little bit more about why you did it, why you started doing the book in the first place.
Well, first of all, I'd like to say that it's a paperback, so it's very inexpensive. And second of all, I did it. I was in graduate school and I was studying the history of the Enlightenment, of all things. And it occurred to me that sex also is an institution, especially the way we practice it, intercourse, foreplay, and all of that. So that's when I became interested. Also, I was in New York now, and we were discussing all the time between ourselves what was happening, and so I decided to do it on a larger scale.
How did you actually gather the data for the book?
Well, I sent out questionnaires all over the country to feminist groups to begin with, and then after that, different papers and magazines picked it up and advertised it, and then people wrote in for it. So it turned out, I have a geographical distribution at this point, it turned out to cover the whole country very well, and I'm doing the statistics now. So,
do you have a general idea who the women are and what ages they are?
Well, they're basically young. They're basically 20s and 30s, but my age range is 14 to 78.
And are they mostly married or single or what?
There are more married women than single women, and a lot of the single women live with someone.
There are a couple of the questions on the questionnaire that I was curious to know how the women answered, and thought perhaps some of the women in the audience might be curious. One of them is having orgasm important to you? How did women respond to that?
With mixed feelings. They felt it was very important on the one hand. On the other hand, a lot of times it didn't matter. And the question, is good sex involved with having an orgasm? People were really torn on that. They would say, yes, it's very important, but you have to have more than that, basically. Everybody wanted to feel emotional.
Would you comment on that, Dr. Kaplan, from your experience with your patients?
Well, I want to comment on Shere's book. I think she's getting some very valuable data for us. The male sexuality has been studied for a very long time, and we know a great deal about it, but we're a bit hamstrung by lack of data on female sexuality, and no one's really sat down and really asked women what are their experience. Do you prefer clitoral to vaginal orgasms, and so on and so forth. So some of the data we're looking forward to getting as being very helpful. Now, what particular question did you want me to?
Do you think it's important to women to have orgasm?
To some women it's extremely important, and it's a source of terrible frustration and very destructive to the marriage when a woman does not. When a woman is married to a man and for years he has orgasms every other night and she never does, she might get very upset and depressed, and really it might be a very destructive thing in her life. On the other hand, there are some women who have never had orgasms who accommodate this very well and don't show any signs of being upset about it.
Is it unhealthy for a woman not to have an orgasm?
You mean physically?
Yes.
There's pros and cons. I would not say the greatest argument for women having orgasms is a health one. Some women go through their whole life without having orgasms and they don't show any sign of disease or anything. Of course, if there's a great deal of stimulation without orgasm, some people say this contributes to pelvic congestive syndrome, chronic pelvic congestive syndrome. There's no real proof of that. No, the main harm is a psychological one. If a woman feels she's being cheated out of a very important, pleasurable part of life that her husband has and that other women have, she gets bitter and upset and feels deprived, then that can be very damaging. And even more damaging if she has those feelings and is unable to speak out about them and be active and take responsibility for obtaining this for herself, she can be severely damaged psychologically rather than from a physical health point.
Is it as important to men, do you think, or more so? I mean, is there a fixation? It seems like we seem to be very concerned. There's a lot of talk about...
You mean for orgasm or
yes,
sex now?
orgasm.
I think the orgasm urgency of young men, of course it's impossible to compare, very few people have been both places.
Right.
But the very young man has an enormous ejaculatory urge, and if he doesn't have a partner or an outlet, he will masturbate. And if you take a history of a male who hasn't masturbated when he was young or had sexual orgasm outlet, you think there's something wrong. You look for some pathology. The same is not true for young women. They have strong sexual feelings, but they don't have that orgastic urgency. After a woman has had some sexual experience and experienced orgasm, then she'll want to have orgasms more. So older women, on the other hand, a man loses some of the ejaculatory urge. An older man can have good sex without needing to have an orgasm, where in his youth that would not have been possible. Young women sometimes don't have a strong orgastic urge, but as they get more experience, they develop a very strong one.
But that might be conditioning.
Oh, I think it is.
Right. So in other words, if men were taught that they weren't supposed to have orgasms when they were young...
Oh, no, I don't think you
know.
could teach men that. The conditioning is women are conditioned to have orgasms later on as they experience.
No, I think that you could teach men that if you took a whole nother culture, you started at the beginning, and you brainwashed them to the degree we've been brainwashed. You could have men who are holding it in, just the same way girls do, but except most girls, by girls I mean under 14, I don't know, they start masturbating very young, I think, and have orgasms.
Well,
So
there are some
maybe
cultures
in their history they don't
that,
want to say
that
so.
forbid males to have orgasms.
Are
The
there? What
Orthodox
happens?
Jewish culture, for example,
Yeah, you're
a
not
man
supposed
is not
to
allowed
spill
to
your
eat.
semen, right?
Not
So-
allowed to touch his penis.
So what happens? Do they?
Most, it causes much more severe problems because the urge is enormously strong, and the repression of that urge causes much more severe problem than in the female.
Psychological problems?
Yes.
Yes, but look at us. I mean, we really have them, don't we? Psychological problems, I mean.
Well, let's
And
talk
then we
about
go
that
through-
for a minute.
Okay.
Let's speak about some specific sexual dysfunctions that are peculiar to the female. In your book, you mention several. We could just take them one by one. There are 3 or 4.
Okay, but I think it's important that Shere has a very defensible position. What I say is controversial and is only based on my clinical experience. We have very little hard evidence one way or the other.
That's probably the
That's
only thing
the
we can
whole-
say, isn't it? That's
Right.
absolute,
Really.
is that we don't have enough information.
Right.
That's
But
right.
about
Absolutely.
50% of girls, if you take a history, have not masturbated before sexual experience. After sexual experience, they do.
50%,
Yeah,
you say?
approximately. And I wouldn't worry if I took
Well,
a
I'm
history
getting
like
more
that.
than that.
Who have not masturbated.
No, who do masturbate. I get more than 50% who do.
Well, these are the
before.
Kinsey statistics, and these are the established.
Perhaps they were afraid to admit it. I don't know, 20 years ago,
Anyway, I don't worry if I take such a history that there's an abnormality, but if a male gives me that history, I worry very
Yeah.
much that there's something very wrong with him.
Yeah, but that's like in psychology. If a woman gives a sort of masochistic position, no one worries too
That's
much
true.
because she's supposed to be masochistic. And I don't consider that normal, no matter how long they tell me most women are. I mean,
But when I say I don't worry, it means that this woman can have a glorious, fulfilled sex life and not have any significant
Yeah.
psychopathology. But if
Right.
a man gives me that history, he can't have such a good prognosis. That's what I mean, not that it's a
Yeah.
judgment.
no, I didn't. I'm just arguing with the whole outlook in general, not you in particular.
Let's talk about some specific.
All right. There used to be it used to be believed that women have 2 dysfunctions. That's apart from orientation disturbances or any other disturbances. These are just dysfunctions that mean you can't enjoy and have intercourse. They used to say frigidity and vaginismus were the 2. Now, vaginismus is a very distinct, rather rare dysfunction of young women where she can't have intercourse because her vagina snaps tightly shut when anything approaches it. This is a conditioned reaction. It's fortunately very rare. It's easily treatable. And in the past, gynecologists would operate on women like that, would actually cut their perineum and cut their vaginal muscles, which left the woman impaired because her vagina would then never function properly. And now we can treat this very easily by simple dilatation and psychotherapy.
After that surgery, could she have orgasms? Could she still have contractions?
The women, vaginismic women have very good orgasms, by the way, usually, not always.
I mean, after the operation.
After the operation, many women lost their ability to have
sure
orgasms.
they did.
That's right.
Yeah.
Some partly on a
gruesome.
it was a gruesome practice.
Really? I didn't
Well,
know
But
about that.
is it a common phenomenon? You said no, right?
no, fortunately
used
it's
to be,
very
I guess.
rare, but it used to be one of the main reasons for unconsummated marriages. And now it's easily treated, just a few sessions of dilatation and gentleness, and the vaginal muscles can be re-educated, so to speak. Apart from that, it used to be called frigidity. All female dysfunctions used to be called frigidity. I've separated them into two separate categories, which to every woman make a lot of sense, but it was big news in the medical world. And that is, I differentiate the totally unresponsive woman from the one that is very responsive but has difficulty having orgasm. You want me to describe that?
Yeah.
a little?
I would
Dysfunction
like
is
to-
always with a partner, right? Is that what you mean when you say
No,
dysfunction?
dysfunction
Could
means
be
it
with
doesn't
yourself,
function right.
not to orgasm.
Yes.
Okay.
Yes, so it can be on masturbation that a woman can't have an orgasm. That would
Do you
be a
find many
dysfunction.
that
Yes,
don't? Really?
about 10% of the country's population don't have orgasm at all, including on masturbation.
How do they masturbate the same way as most people do?
Yep,
And they still don't.
that's right.
Wow. So what do you do in a case like that?
Well, you want me to describe it first or go into treatment?
Either way.
Why
Well,
don't you describe it?
okay, the totally unresponsive woman can have a man make love to her gently and nicely and take, I think Dr. Sherfy said 15 minutes of foreplay, which incidentally is not a standard, everyone varies, but can have foreplay and be treated gently and be stimulated correct, and she just doesn't feel any erotic feelings, and she doesn't physically lubricate, and her vagina doesn't expand. She simply is unresponsive sexually. Sometimes such a woman can have an orgasm, incidentally, paradoxically, but she just doesn't have any of the joy and the erotic feeling. That's a generally unresponsive woman. These are rather rare. Those are truly, quote unquote, frigid.
It's what we used to call frigid, or do
Right.
we still?
Well, if somebody called that group frigid, I would object only because frigid implies that they're cold and nasty, and they're not necessarily. A woman who has that problem can be warm and, psychologically responsive, but that is a truly frigid group because they really do not respond. The other group is much, much larger and used to be called frigid and certainly should not be called that. And that is a woman who responds and has sexy feelings, and she lubricates and her vagina expands the way it does in excitement. And she has all the physiological and psychological responses, but she has various degrees of difficulty in reaching an orgasm. Sometimes she can't reach an orgasm at all. That's about 8 to 10% of the population. Sometimes she can only reach an orgasm when she masturbates while she's alone. Sometimes she needs an excessive long time with a great deal of stimulation and fantasy, so on and so forth, to the other end of the extreme where a woman can fantasize to orgasm and can have an orgasm after just a little bit of intercourse. But the woman who has trouble having an orgasm has a different dysfunction, which I call orgastic dysfunction. It shouldn't be called frigid.
How do you treat the inorgasmic woman? You knew I
Well,
was going to say that, right?
Yeah. Yes? Did
Go
you?
ahead.
Because, well, I can only answer that in broad strokes. I certainly can't give you the total outline. The whole thing. It's a very complex sexual therapy. It's a very complex branch of psychiatry, really. But the basic principle in a woman who can't have orgasm is to first teach her to have an orgasm by herself on masturbation, so she learns her own body and she can abandon herself to her sexual feelings and fantasies without worrying, my husband thinks I'm sick, it's taking too long, his hand will get tired, and worrying about it.
Is this a generally accepted form of treatment for an inorgasmic woman?
It is in the field of sex therapy. It is not in orthodox analysis. It's very unacceptable. An orthodox analysis makes the assumption that women don't have orgasms because they hate men and they want penises, and that has to be resolved. And I don't want to put psychoanalysis down. I am a psychoanalyst. I practice psychoanalysis when it's appropriate. but psychoanalysis has neglected some very obvious, specific causes of sexual difficulty.
Yes, because many people who have very hostile feelings or are very upset have orgasms.
Have beautiful orgasms.
Right, so
exactly.
you can't really make a correlation there at all.
On the other hand, a deep hatred of men can be one of the causes for lack of orgasm. It can. Doesn't always, and it certainly isn't in all
Not with
cases.
yourself. You know, you're talking about
Even
people
with
who
yourself,
don't.
because when you're with yourself, you still have a fantasy.
Oh, well, you could fantasize women, you know, you don't have to fantasize men.
That's true.
Or you could just fantasize a stranger or yourself.
Well, a deep hatred of men can be an impediment to good sex. It isn't always, and it isn't often, but it certainly can be.
Well, having
Wow.
damaging things happen to you, I'm sure could be
Exactly.
damaging in every area. But
What about sexual anesthesia?
That's actually a neurotic symptom. That's not a dysfunction. Dysfunctions are psychosomatic, where something really doesn't work. Because, do you want me to go into a little bit about
Yeah,
the
I'd like to.
physiology?
Yeah.
All right, you see, when a man is aroused, it's very obvious. His penis fills with blood and he has this big erection. You can tell what's going on. A woman has quite a comparable and equally dramatic response physically, but it's internal, so even the woman doesn't really realize it's not part of your self-concept. For example, when you get aroused, your vagina balloons out inside. Now, you don't even feel that. You don't know that. You
but
feel
isn't
excited.
that isn't that the sensation when you sort of want something to enter you? I mean, isn't that when the ballooning out happens?
Perhaps.
That's in the middle, just before you're, well, anyway,
Perhaps.
I think that's what it is.
That's very interesting. But you never really knew that your vagina got bigger. You may have felt the sensation of wishing intercourse at that
Right.
time, but there are not enough sensory nerves there. We can't tell that. Also, the whole pelvis becomes congested with blood, very much like an internal erection. And you feel a lubrication, and that's about the only thing you feel. And the uterus rises. It's usually down low, and it rises up during excitement and becomes erect. And all these things go on inside. And when that doesn't work right, that's unresponsiveness, and that's a physiological dysfunction, caused psychologically, but it's physiological. In anesthesia, everything works right. The woman lubricates, her uterus comes up, her vagina balloons out, but she doesn't feel a thing. It's a neurotic symptom, like having a paralyzed leg or a numb area or hysterical blindness. It's a hysterical symptom. It's not a dysfunction. Sure, it's a sexual problem, but it's a different dynamic.
How would you treat it?
That has to be treated with psychotherapy to get on the unconscious determinants, not with sex therapy.
Has that been very successful?
Hysterics can usually be treated very successfully, but they always get something else wrong with them again a year or so later.
I see.
It's a personality that tends to form hysterical symptoms. You know, you cure that, and then they can't walk, and then, you know, it's. But you can treat that successfully. It's very rare.
Oh, it is rare.
Yes, the orgastic dysfunction is the most common, and there's been a lot of confusion because many doctors consider, and we were talking about that before, and it's very, I think, important to talk about. Many doctors consider if a woman doesn't have an easy orgasm on intercourse, even though she can have multiple orgasms and is very responsive, they consider that frigid.
I know, and it's given rise to this whole school of thought, maybe my clitoris isn't close enough to my vagina. You know, somebody in the questionnaire had said, in the best of all possible worlds, what would sexuality be like? And one person said, I would have a clitoris in my vagina. You know.
That's the deep throat fantasy.
Is it? I didn't see it.
There's another one of your questions, Shere, that I'd like to find out what sort of response you got. And the question was, do you feel free to do all the things you would like to do, or do you think the other person would be shocked? What sort of response did you get to that?
Well, that question, people felt pretty much that the other person would be shocked, or that they weren't. There was another question, do you practice everything that you know? And most women said they didn't, whereas perhaps they thought the men did, but they didn't do everything that they knew because they felt he was supposed to take the lead, and they weren't supposed to take the lead, and maybe they would shock him, or maybe they would seem like a whore, or whatever. They're not supposed to know too much. We're supposed to be blushing brides, I guess, all our lives.
But Dr. Kaplan in her book talks about sexually assertive women running the risk of displeasing their husbands.
Well, we better change things if that's what the cost is.
Would you want to elaborate a little bit on that?
Yes, if we treat a woman, if I treat a woman who is having trouble sexually, it usually means she can't really abandon herself because she doesn't take enough responsibility for her own sexuality. She sort of sits tight passively and waits for the husband to do something to her, just as you were saying.
Right.
Under those circumstances, you can't function. You just can't. You have to be an active participant. I don't mean aggressive.
Well, it's
Not
just that
aggressive,
aggressive
but
has a terrible
active.
connotation, but
No, but I don't think you should be demanding and insensitive in any situation. Certainly not in a sexual
Oh,
one.
you
but
mean either the male or the female?
or the exactly, exactly.
well, you know, some people like to be passive sometimes. Even men sometimes like to be
sure.
passive. So, in a special situation, I suppose you could be aggressive.
Well, I
But I
don't
know
think,
what you're saying.
I don't think the problem is that women have trouble being passive. I think they have trouble making
Right. No,
known.
I certainly never meant to imply. They had trouble being passive, or we had trouble being passive.
But it is important to distinguish active. If you know that a certain thing will stimulate you, you have to take responsibility for letting your partner know
Yes,
that
but-
this would give you pleasure. So
Yeah.
as part of the sex therapy, we always try to get the woman to be open with herself and with her partner in a very active way, and then she becomes more responsive almost automatically. Now, if a man is really secure and loving, he welcomes this, because it's obviously more fun to make love to an active, responsive partner, no matter what
Yeah.
gender you are, than to someone lying there like a log,
Right.
waiting to be served. But if a man is insecure, or if he's been taught that it's his role, if he's burdened by the machismo role, and I say he's burdened by it, then he might become very threatened, temporarily usually, really threatened by a woman becoming more assertive and independent sexually.
Yeah.
And that's when the sex therapist has to be very careful to support the marital system between the couple during this temporary adjustment stage. In the long run, the man is usually much better able to function himself with an active woman.
Say it's acceptable to the partner. How does one achieve this abandonment? I mean,
Well, abandonment is not the same thing as assertiveness. In order to function sexually, you have to be able to cut off and really give yourself to it. That's true for both men and women. If you don't abandon yourself, if you're watching yourself all the time, I'm coming quickly enough, am I attractive, is my body pretty, is he coming too soon? If you have those kind of thoughts in your head, there's no way you're going to function.
I take exception to the responsiveness term because in the same way that you say you're not supposed to be aggressive, you're supposed to be responsive. That's what women have been told. And I mean, I don't think you mean it that way, but to be responsive is the idea is the man is supposed to do it, and you're supposed to be responsive to what he does. And you're supposed to abandon yourself to, this passion between you, but mainly to what he's doing to you. And I don't think you mean that.
Well, when we have a conversation, you're responsive to me and I'm responsive to you,
Yes,
and I
when-
mean it in that sense.
Yes, but in the vocabulary of sex, responsive has come to mean female. The male gives the woman an orgasm. She gets laid, whereas, he gives himself the orgasm, right?
I
Would you
see
agree
what
with
you're
that?
making. Well, actually, when we call the unresponsive male, we're also, erection problem is a man who's not responsive to sexual stimulation.
Yes, but it's usually considered that he's the one that's creating the situation.
And that shouldn't be. So
No,
it should be an
definitely.
interaction.
Right, it should be. Therefore, I think that, shouldn't use the word responsive.
No, I think we maybe should reevaluate that perfectly good word.
Yeah, it's a great word if it just didn't have all these bad connotations. And abandonment is a beautiful word, except that men have been, saying this for years to women. Oh, just let yourself go and everything will be fine. Do what I want.
Well, I
and,
tell you, if a man can't abandon himself, he's in the same kind of trouble. And half of my patients are men and half of my patients are women.
I have another word for you.
Yes.
Rejection. Do women fear rejection as much as men, do you think?
It's a hard comparison, but I can tell you many women are, as we talked before, they're really haunted by this fear of rejection. They feel if this man rejects them, they'll be lost in this world, in this jungle, if they don't have this protector. And so
used to
they're
be true.
in many cases, yes.
There were no jobs for women until the 20th century, so therefore they had to be protected, but now we don't have to.
Yeah, but even in the upper classes, when women had their own means, this idea of being without a man used to be tremendously frightening.
Well, you didn't have social acceptance, really.
Exactly.
No.
So that instead of being able to abandon herself, and I mean to her pleasures, not to him, she'd worry, am I pleasing him?
Well,
is he going to come good? Is it time for him? And if not, he's going to leave me. And that will put a dampener on
But
any
a lady
activity.
didn't abandon herself, you know, at that time.
Did you ever read the Victorian novels?
Yes, that's what I studied. But in novels, that was...
A few minutes ago, you both mentioned the word fantasy several times. And, you know, I wonder, do women have sexual fantasies in the same way that men do?
Well, in the same way that men do. I don't know. I've never been in a man's head. But they have fantasies, sure, just as much as men do.
Is that something that you got from your survey?
I think women have to depend on fantasies more than... I guess men would use fantasies in order to make sure they had an erection and kept it at the right moment. But women have to use it to have an orgasm because they're getting insufficient stimulation. So when they decide it's time and they've been waiting too long or something, they have to sort of click it on. I'm getting that. Do you hear that?
I don't think if you have inadequate stimulation, you won't have an orgasm whether you have a fantasy or not.
Well, I think you can certainly increase the stimulation quite a bit by what you're thinking.
I think you can bring on an orgasm that way because a fantasy distracts from anxiety. If you're worried about you're not coming fast enough, you're not pleasing a man, or if you're masturbating and don't really want to realize you're all alone, you have a fantasy and it distracts you from reality, and you go with that fantasy and you abandon yourself to it, and that's what brings on the orgasm in both genders. This is absolutely true for both. If anything, women use fantasy a little more. I agree with you.
We're out of time.
Oh.
And I'm very sorry to tell you that.
So fast.
Because we could go on much longer.
Can you say that people can still answer the questionnaire? They have to write for it.
Sure, we can say that. Thank you both very much, and thank you. See you next week.